Good morning, everybody. Scott Mayboy here. Tuesday morning. Hope you all having fun. Let's see. What a couple of things. Sold my first Maine Blue Cross policy yesterday. Two of them, actually, to a husband and a wife. I can work in other states. The Medicare is virtually the same. Massachusetts, of course, has to do it differently, but almost every other state does it the same way. So if you have friends or family in other states and they need help, I can certainly help them as well. Wanted to point out an article. I posted it yesterday from Forbes. Kind of interesting. It talks about Americans' aversion to copays and deductibles, but how we pay so much more for healthcare premium because people are afraid of deductibles. And it wasn't actually, it was talking about open enrollment, but not Medicare open enrollment. It was talking about health insurance. But I see this all the time with Medicare recipients and non-Medicare recipients. For those of you who are on a group health plan from your employer right now, you're probably paying a deductible. You probably have copays. Very few of us don't. And in the Medicare world, people are willing to pay for a supplement, which is around $200 a month, to avoid copays, to avoid deductibles. Well, that makes sense. If you're not well, if you're anticipating some surgeries, if you know you're going to have the copays and deductibles, then it's a simple matter of, well, which is going to be more expensive? $2,400 eliminates them, $200 a month, or would I rather simply pay the copays? Whichever is cheaper, that's the way you go. But for many people that I talk to, they're healthy. They're not anticipating many copays. They have a few doctor's appointments. They see a few specialists. So they're willing to pay $2,400 to eliminate a few $100s worth of copays. Now, don't have a crystal ball. Somebody with copays could suffer a really bad accident, could have a bad diagnosis, and up the copays. But is that risk, to mitigate that risk, you're paying $2,000 a year, or $2,400 a year, times two in many cases if it's a couple, and does it make sense? I mean, there's a comfort level, there's an affordability level, there's a cash flow issue, but those are considerations that, the point of the article is almost all of us are way overpaying premiums because we're so worried about the chance of a copay. So that's, my thought for the day. You can check out the article. I pushed it yesterday. It was from Forbes. And, in Massachusetts especially, you're not locked in. So if you say, something, knock on wood, I'm healthy now. Let's go with the low premium deductible version of the plan. And then if something changes, you may have a bad year, but if you go 2 or 3 years saving $2 grand a year, $2,400 a year, in 4 years, you got almost $10,000 more with interest. I don't know, that's going to cover a really bad year in deductibles, and I'd rather have the 10 grand in my pocket. Just my thoughts. Certainly, it's the decision of whoever I'm sitting with. The people in Maine didn't agree with that. They wanted no deductibles, no copays, because they're not good at paying bills. So she said, rather than be sent to collections, we'd rather just basically pay up front in case we need it. Doesn't make any difference to me, quite honestly. I lay out the math, I lay out the options. You decide what's best for you, and no judgment. Whatever you feel is best for you is the best plan, and that's what we enroll you in. If you have any questions, comments, thoughts, you need help, we're always here, we're always happy to help, and there is never a charge to work with us. So you don't pay us. If you, like in the case of the people yesterday, they signed up for Blue Cross. If they had picked up the phone and dialed an 800 number, they would be paying the exact same monthly premium as they got with me and my 3 conversations of an hour plus to help them sign up. So if you think it's worth it, reach out. Happy to help. Have a great day, everybody. Stay safe, be well, and talk to you soon.